Hi folks, this is John Adamson, the Rehab Documentation Guru, and today we're going to look at documenting things that might be a potential implication against us and or the people we work with for patient rights. Patient rights are inviolate, however you want to say that. And this is a piece of documentation. I've altered it to make it more just generally relatable to any typical patient, and also to take out any possibility that somebody would look at and think, hey, that looks like my documentation. So here's the sentences that I saw. Patient very agitated, anxious due to losing blank. Now this is a patient with dementia, so very problems with orientation and alertness and memory. Per nursing, so this is what the therapist wrote, per nursing, they took her blank away due to contributing to her exit-seeking behaviors. And if that gives you a little bit of pause, it should, because one of the resident rights that is stated by federal government, recognized by Medicare, is this right, the right to privacy and to keep and use your personal belongings and property as long as it doesn't interfere with the rights, health, or safety of others. And that's kind of important because this blank, and I'll just tell you, it was a blank item that could not possibly harm another individual. And this item gave the patient comfort knowing where that item was. And with dementia, having things that give you comfort and prevent you from becoming agitated is rather important. And this was a case where this item, which was not harming others, did not interfere with the care of others or put others at risk, was taken from the patient. And the nurse's response was that this item was contributing to the patient's exit-seeking behaviors. Well, is that truly accurate? Is there really objectivity to that statement? It really does not make sense. Um, they would need to have strong support that this item really truly did cause problems with patient exit seeking and making it unhealthy for the patient to have it, but there was nothing in the documentation about that. The other thing is the therapist may have just thrown the facility under the bus. And I've talked in my course about being careful not to throw other disciplines under the bus or the organization that you are working for, because it may come back to bite the whole organization. These kind of things should be able to be handled internally. And this would be just a point of education, that patients do have rights. So if you work in any type of setting, I would just advise you to look up patient rights. And this was under resident rights for nursing home residents. Again, recognized by Medicare. This would be something checked on by state. And this statement is a concern, and it might prompt further investigation. Anyway, this is John Adamson, the Rehab Documentation Guru, coming to you live from Ashland, Virginia, which touts itself as the center of the universe, sitting outside of Starbucks. Anyway, I hope you're having a great day. Take care and keep those suggestions for videos coming. Bye-bye.